So our topic will discuss the SAC regression outcome in the EVAR. So through this presentation, we will talk about if we understand also the mechanism of the SAC regressions and the factors that are affecting in the SAC regressions either in positive way or different way. And by the end, I will put also my experience in this topic. So the mechanism of the SAC regressions actually, if we got how to occur by reduction in the intra-SAC pressure due to exclusion of the systemic blood flow, and also this lead to remodeling of the aneurysm wall and thrombus organization within the SAC. So one of the lectures or one of the literatures that's present, it showed how it's decrease in the SAC regressions, it's decreased by almost 1 centimeter. So the first study a systemic review and the anatomical predictors for the abdominal aortic aneurysm remodeling after endovascular repair. And it was published in 2022. And in this study, the conclusion was the anatomical factor of the aneurysm. It's very important, especially the aortic aneurysm neck and the thrombus in the aortic aneurysm, and also in the neck mainly, how it's affecting in the regression of the SAC wall. This one of the systemic review, and for this reason we go also in other studies, which is variability of the aneurysmal SAC regression after endovascular aneurysm repair based in the comprehensive registry of the patient in the Eastern Ontario, and it was in 2019. In this study, they also looking for other factors, which is other than the anatomical factors. They looking for the age and the sex of the patient, and also is it emergencies or non-emergencies case. So over those running systemic reviews, we summarize the causes for the factors into 3 parts, which is the patient-related, anatomically related, and also device that's also used related. So if you're looking to the anatomical related, or if you look into the patient-related, we have the age is, with the young age is positive factor for shrinking of the SAC, and the gender, female gender also is a positive factor, and medical history using of statin is positive factor, and neutrophil and platelet factor related ratio is very important also in the investigations upon the systemic review that's mentioned first, and also in this studies reviewing. So the other factors which is related to the SAC, which is the presence of endoleak is a negative factor, and hostile neck also is a negative factor, and the presence of the thrombus, abdominal aortic thrombus, is a negative factor, and outside of the IFU guideline, which is also for the stent using, is negative factors. Factor related to the stent use or device use, actually this study, it was focusing and reviewing all the factors related to the mechanism use, and they found the Zenith material or Zenith stent is one of the most important, and it is less device for the increasing the SAC propagation, or it's better for SAC regressions. And they summarize the presentation into ultrafiltration of the plasma from the stent, and also macro tears in the stent itself, and altered cellular ingrowth, and also the post-implant inflammatory process in the stent itself. So our experience in Asir Central Hospital, we have one case reported, which is actually for the non-shrinking of the stent, and that was ended by aortoesophageal fistula, And in the OVAR study, we found the old age and male gender saccular aneurysm of abdominal abnormal sac, and also the using of the stent, it was outside of the IFU because the patient was emergency, and it's ended by the aortoesophageal fistula for the patient. And all this paper, it was in negative side. The other papers also, it is in positive side, and we found that the positive factor, it was female gender and proper time for intervention in elective cases, and IFU guidelines was applicable, and also it was better for the shrinking of the stent of the aneurysm, and it's shrunk by 7 millimeter over 2 years. So this is my experience in the shrinking of the aneurysm, and the systemic review was mentioned internationally. And I think this is the time for the Saudi Vascular Society to put hand to hand in the vascular art, and also for publishing more. We great thanks for Dr. Mahmoud Salah. Really, he invited us, and we are joining him to sharing our knowledge and to sharing our experience, and also to learn from each other. And I hope one day to see you in my hospital, which is in my city, Abha Central Asir Central Hospital, and also to present vascular art or in putting hand to hand with the Vascular Society. Thank you very much.